to help you, to help us all understand the impacts of all of this and how to deal with this the longer the pandemic continues. Dr. Christine Purden is with us, who's a professor of psychology at the University of Waterloo, and she is in Kitchener this morning. Dr. Purden, this is going to be valuable time spent, and we welcome you to our program this morning.
Thank you.
I'm sure you were reading that Public Health Agency report closely yesterday as it laid bare in the starkest terms how Canadians are feeling from a mental health standpoint. Is there a mental health crisis in Canada right now owing to the pandemic?
I think that it's certainly there. Everybody is under a tremendous amount of stress. And I think it's important to recognize that it's normal to feel stress under stressful circumstances. I think that the very large-scale systematic epidemiological studies have not yet been done to tell us whether there's actually been a change in psychological diagnoses, for example, but there's no doubt that people are experiencing an unprecedented amount of stress and loneliness and sadness and anxiety.
So that was reflected in the Public Health Agency report. Can you go into some more detail? What are you seeing in your practice? What are you hearing from your colleagues?
I think that what we're seeing is just starting a bit of burnout. Like people have, originally we were in crisis mode back in March. Everybody was pivoting on the fly, trying to make sense of things, trying to understand what was happening and predict and just sort of managing on a day-to-day basis. Now we've had many months of this. We're into month 7, 8 of this. And I think people are starting to feel very, very tired of the stress and very tired of feeling fearful about what's going to happen next.
And in that report, I don't know if there's anything that really stood out for you. As I was mentioning, the litany of behaviors that Canadians are turning to get them through that stress and anxiety, whether it's drinking or taking drugs or not working out, just kind of, being on the screen. It spoke about young people who are feeling an overwhelming stress and anxiety for a variety of reasons, including job loss. Was there one finding that really concerned you most?
I do think that the strategies we're using to manage the stress are of concern, and that's both for adults and for adolescents and youth. I think that some gyms are open, but people are still a little bit worried about going to gyms, so we're not getting outside exercising. We don't have to go to work, so I think people may be increasing their alcohol and other ways of managing stress that they might not otherwise if they had to be driving and had to be out and about. And as well, people are under more stress, so they're trying to manage more stress. So I think that this is a marathon, not a sprint. That's really clear. Like, we're in the second wave now, and there's a lot more to go. So I do think thinking about how we handle our stress is really important.
And we're going to do that with you over the course of the morning. I want to get to some of your solutions in just a second, some of the tips, because as you say, exercise in a gym setting is not necessarily available to everybody right now. But before we get our way out, I do want to get your sense on what might make things worse in the short term. Winter. We're going to turn back the clocks this weekend, not have as much sunlight, and that is going to, one would think, exacerbate things. How do you think winter is going to affect our attitude toward the pandemic, or just our attitudes generally?
Yeah, so I think, winter's tough because of the, like you said, the daylight. We're also heading into what would normally be a very celebratory season for people. And this is a year where people are just simply not going to be able to withhold. Many people are not going to be able to withhold their typical traditions over the holidays. So I do think that and also, of course, it's cold, so there's not the opportunity necessarily to be able to sit outside and get together socially. So I do think that we need to be very planful right now to try to figure out how we're going to get ourselves through the winter, because winter's not going to go away and COVID's not going to go away.
No.
So we have to control what we can control.
You're socially, though, they're keeping the patios open, Dr. Purden. We're going to be bundling up to eat out, and that's going to be at least one social interaction outlet. But
Indeed.
Let us turn to some of your solutions and spend the bulk of our time this morning looking at this, because it is bleak and it is going to get bleaker potentially. We've been inviting viewers to send in submissions. Dr. Purden, I would just want to begin our conversation with Brian's pictures. This is Brian McStravick. This is how he's getting through. Walks in the bush. I think we have that picture. Yeah, here it is here. Walks in the bush with my furry friends. Brian's in Manitoba. So out with the dogs, out in nature. That's his solution. Let's go through your top 3 on this particular conversation. So give us some coping mechanisms.
So I think out for a walk is a fantastic thing. So when we're under stress, our bodies are in fight-flight mode, and so we have a lot of adrenaline. We're revved up. But if there's no obvious, tangible danger to flee or fight, and it's more vague and just stress, then we're revved up with no place to go. And so being able to go out and burn off that adrenaline is extremely helpful. So I think that getting out once a day, I think now would be the time to get yourself some really good warm gear and some excellent boots for the winter. So instead of hiding and hibernating for the winter, let's think about how we can be out so that we can get out and about and exercise. So absolutely, that's one top one.
Okay.
The second, sorry.
Nope, that's good.
Okay.
Second one?
Second one would be containment. We can't live and breathe COVID. We just can't. We can't live and breathe the unemployment, the problems. Even though they're there, they're big. We need to be able to find pleasure and joy in our lives despite what's happening. So we need to limit how much time we spend information seeking and, get the information we need for the day and then get off the internet and do productive, constructive things. I saw in the tab somebody was saying that they're taking ukulele lessons. And I think we need to find ways of enjoying life that are not COVID related.
Such as music, nature, those kinds of things?
I think so, yes. And just read a book, put music on, connect with people in a non-COVID way. So connect with people and talk about the things that you used to talk about in the time before, rather than spending your time dwelling on the COVID issues.
I think that's such a good point. In our Zoom conversations with friends, so often all of the time is spent on how you're dealing with COVID. So maybe put that aside and talk about anything but COVID.
Exactly. And it's important to keep in mind that moods are contagious. So if you're speaking to your friends and you're in a very stressed and anxious mood and you only talk about what's making you stressed and anxious, chances are other people are going to start feeling stressed and anxious as well. So I think that if we can find ways of, meet with your friends, do your quick debrief and let everybody kind of vent a little bit, but then move on the topic of conversation to things that are positive, constructive, and non-COVID related.
I was struck by something that you said about how we need to approach the pandemic from the standpoint that it's a marathon and not a sprint. I have a little bit of tape to play for you. Dr. Anthony Fauci, the top infectious disease expert in the United States, he's really the face of pandemic response. He had rather sobering assessment of things as he spoke to academics in Australia yesterday. Let's listen to this together.
If we get a vaccination campaign and by the second or third quarter of 2021, we have vaccinated a substantial proportion of the people, I think it will be easily by the end of 2021 and perhaps even into the next year before we start having some semblances of normality.
Okay, so I can just hear Canadians collectively sort of gasping in horror, 2021 and to 2022. Now, that's a projection at this point. But why I wanted to play that for you is because it struck me that we become disappointed if we think something's ending and it doesn't end. Then you're really disappointed. I feel like it's important to sort of get our head around the notion that this is going to be something that we may have to deal with for a very long time. Can you, from your professional view, talk to me a little bit about that?
I think you're absolutely right that we do better when we have some capacity to predict and control. And I think it's certainly at the beginning of this pandemic in March, I think one of the concerns was like we just had no idea what was happening and how deadly it was going to be, how overwhelmed everything was going to be. Now we have a bit more knowledge and understanding, but we're getting really tired of our lives being restricted in the ways we don't like. And so I think you're absolutely right that having a sense of when this is going to end can be helpful. On the other hand, knowing it's going to go into potentially into 2022 could be fairly depressing for people.
So with a long-term view, how do we approach this then from a psychological standpoint that it is a marathon?
I think that we really have to recognize, as we said the last time, that COVID is not going to go away in the near future, nor is winter. And we have to adjust our expectations accordingly. And we need to accept it. Accept doesn't mean like or condone. Accept means recognize that this is the way it's going to be and there's nothing we can do about it, and figure out how we're going to manage it. And we may want to reference other generations that have been through perhaps in some ways even worse things, such as First and Second World Wars, where lives were very, very, very disrupted in every way. And that went on for years. So I think we need to reference the fact that we are resilient as people. We can get through these things, but we do really need to be planful and mindful about making sure that we do the things we need to do to get through it.
In terms of what is ahead, we've heard from officials warning of the long, dark months to come. We're going to change our clocks. We're going to send them back this weekend. For the winter in particularly, what concern do you have?
I think that one of the concerns I have is that, first of all, winter reduces the opportunity for socializing the way we've been doing. So in the summertime, we've been able to get out on patios, et cetera. I know patios are staying open until December, which is great, but that might become increasingly less tenable, particularly as temperatures drop. So I do worry about how people are going to manage, continuing to socialize through screens when they've spent all day on screens. So I think that's a bit of a problem. I think the reduced daylight does take its toll on people. And I think that even though we're Canadian and we're supposed to be rugged, we actually tend to hibernate a little bit in the winter already. And I think that we can't afford to do that in these times.
I love your tip for getting out there and getting into nature, and we'll get to that in just a second. I do want to ask, though, your view on this. In Quebec, for example, we heard from the province yesterday, $25 million as a first step towards some psychological supports for young people, notably. What kind of help do you think needs to come from governments, from provinces, from Ottawa perhaps as well, on this mental health aspect right now? What would be most helpful?
Yeah, so I think that, mental health has always been sort of the poor cousin of health in general. And certainly there's a massive gap, but there's always been a massive gap between mental health need and mental health services. So I do think that we need to start promoting or start helping people access services. We need to support therapists. We need to connect people with evidence-based services. So not just any mental health services. We need to be providing people with effective, proven mental health services. And I think one of the challenges that we see as psychologists is that, and any therapist actually, is just the availability of accessibility of telepsychology. So something as simple as helping people get internet access that is unbroken is going to be absolutely critical to helping people connect with therapists that they need.
Virtual therapy, part of the future wave of this as a potential solution. I want to bring you in an email from one of our viewers, Robert, because it speaks, I think, to really puts an individual story to the reports. Really quite a bleak picture. Robert has some health issues, living in conditions that do not sound like they're. They just sound very challenging, to say the least. He lives in a rural community, no family to talk to. He's wondering on how he keeps his sanity with all the stress of the living conditions and COVID-19. Can you get into some of your strategies for Robert and for everybody else?
Yeah, so I really feel this. It's so difficult. People have so many different challenges. It's very heartbreaking. I think that no matter what, we have to find ways of finding beauty and joy. So whether that's finding a way to enjoy some music or to enjoy something and making time for that in the day, I think is really critical. I also think if there are ways of connecting with, there are so many social groups now, emerging on the web, finding a social group on the web that you can connect with. And whether it's starting something like music or ukulele or art or something that you can do in your room that allows you to connect with people through remote means would be really helpful, I think. I think it's also important to recognize it's okay to be stressed when you're under these stressful circumstances, and to again just try to focus on what is good, what things that give you beauty and joy in the world despite this.
Find the joy wherever you can find it. Maybe people perked up when you said ukulele. There's a reason I think you said ukulele, because Patricia wrote to us from Fredericton. We should pull up Patricia's note to us. Some of her coping strategies she wanted to share. Tries to get out and embrace winter. She has really eats healthy foods. Meal planning is important, does as much exercise as possible. But here's where the ukulele comes in. Self-taught ukulele player, and she keeps on practicing. So that would boost the spirits, to say the least. And another note on the music point. Irene writes to us this morning, Dr. Purdon, I find when I listen to my favorite upbeat music, it really lifts the spirits. We have in our morning team people who send songs of the day back and forth to get the mood going. It happens to be Shawn Mendes today. That's the song of the day, Wonder, just in case you are wondering about what that is. So finding the joy, and I think it was a really important thing that you said last hour, in terms of this approach that we've been through challenges before, and we have surmounted challenges before. Can you speak to that again?
Yeah, so if we think about previous generations who had to endure the First and Second World War, which went on for very, very long time and highly disruptive at every aspect of life, and in Canada, rationing and the people fighting, and also just not the immediacy of the news. So you could go for long periods of time not really knowing what's going on. And I think it's important to recognize that we are very resilient, and we tend to focus on. We tend to get worried and focus on what's not going well. And I think we need to step back and recognize what coping strategies and mechanisms we have to bring to bear on these kinds of things. And I think the creativity that we've seen has been wonderful as people figure out ways to connect remotely and to circumvent the restrictions of COVID.
Could I ask you one more question? One of the things that has been put forward is the observation that we're not helping each other to the same degree this time around. Certainly when COVID arrived, we were talking about all sorts of heroes and helpers and how people were, banging pots and cheering on healthcare workers and coming together to provide food, and just a real collective will to get through this together, which seems to be in short supply this time around. Even we were grocery shopping this weekend. My husband and I looked at each other and said, people look angry in the aisles. There's not, it's dark. It's very, very worrisome, I think, to look at people's approach. How do we get back to this collective coming together to tackle what we've talked about this morning, this fact that it's a marathon?
Yeah, so I think one thing that can be happening is that we've been going at this for so long. We had the nice, to some extent, some reprieve in the summer, but then we came back to the grind, the uncertainty of school, et cetera. And I think that one thing we can forget about is that anxiety is both a fight and a flight response. And so when we're stressed, we can become angry very quickly. And we've been dealing with this for a long time. And so it may be that when we're out and about, our attentional scope narrows quite a bit when we're anxious. We become very threat sensitive. So if we're out and about and thinking, okay, I have to figure out how to handle childcare for my kids because they're not allowed to go to school because they had symptoms, and I can't take time off work, my spouse can't take time off work, and then you might spot somebody who's not wearing a mask. And you might immediately turn to anger and just think, you're the reason that I'm in this very stressful situation. And I think that we have to make a really strong effort to zoom our mental lens back out and take a step back, take a breath, and say, I'm aware of being angry, as opposed to, I am so angry at this person. And be able to cope. What we do next with that is our choice. And I think we need, this time more than ever, we need to cope in compassionate ways with things that have upset us. If we zoom our mental lens out, we'll also see that maybe 9 out of 10 people are actually wearing masks, but we just haven't noticed it because our anxiety narrows our attention.
Dr. Purdon, I've so enjoyed all of our conversations this morning. I thank you for answering our viewer questions and for sharing your solutions as well. I hope you'll come back. I think we're going to be having to deal with this for some time to come. I look forward to next time.
My pleasure. Thank you so much.